But is there someone that you would definitely recommend not try this without it?
Yeah.
Because it could go real south real fast.
Yeah.
We've talked about how a lot of these things that people would feel if they were to ingest a substance like psilocybin. What about the variance of the same dose across individuals? Some people might call it a bad trip.
Yeah.
How does that work? Is that completely dose dependent too, or is that based on something that's individual within me versus you, let's say?
Well, just to kind of go back a little bit, when we were talking about that activation with the drums, then the next phases of that, then as you start to come down and the person has kind of given up their ego and they've blended in with everything, and everything seems to be just one experience. Then it starts to go over to some female vocals, some very soothing things, and then some nature sounds is where it kind of ends. And so it's a very peaceful, decay phase. And the person after that, they feel like it's kind of taxing on them a little bit, and they feel a little bit tired. But each individual comes to this in a different way. So it's important, and that's why you have a therapeutic setting where you have some rules to this and some boundaries. Because if you did this in a unsupervised way, it could be quite dangerous. And that is because it's hard for the person to understand normal boundaries or even safety. So they have to be in a very safe environment. And there's two things. It's called set and setting. And the set is really the mindset. What's your mindset that you have when you come into a therapeutic session? If you've just had a fight with your spouse and your kids and you were laid off from work and you're experiencing a lot of stress, or you're in a car accident, probably wouldn't be the best time for you to go on a psychedelic trip.
So let me just jump in right there. That brings up a really good question in my mind. Here at the law firm, we see people that have been in pain and trauma from crashes or all this stuff. In the sense of, we know that it's not easy to always get through those cycles with the pain and getting their healing back. Are psychedelics, specifically psilocybin, are they ever used for acute physical or mental or emotional trauma, or is it more of you would use these things in a chronic case after things have calmed down neurologically, so to avoid the bad trip?
Yeah, I think you have to separate the acute trauma. I just don't see a scenario where someone's in an ER or experiencing an acute trauma where adding psychedelic drugs would be helpful. I think that would be very harmful, in fact. I think what the person has to do is they have to experience their acute trauma, and then where it becomes useful is on the therapeutic healing side. In people who've had post-traumatic stress disorder, where they months and years later they're dreaming, they're reliving these events, and they're having a hard time with the intrusive thoughts, then that would be a perfect scenario to go on one of these therapeutic psychedelic sessions, because it allows some rewiring of the brain. It allows the brain. There's a good evidence that there is plasticity that occurs following these sessions that's induced directly by these compounds that enables the brain to reorganize itself. And there's looking at trauma and even drug addiction. Some of the things that we had been working on and that they're working on right now that's really cutting edge is that this idea of reconsolidating or changing memories. And is it possible that you have someone who has a memory where they're addicted to some drug in some context? How do we erase that? Well, you can't really erase a memory. You can just add new learning. But it does turn out that you can take the circuits that have coded for this memory of addiction and this habit, and these are stable neuronal networks that have been around for a long time, and it's very difficult for people to change. But it does turn out that if you can take this individual and put them in a similar context, And this is something that we were working on, is put them in a virtual reality where you put on the headsets and you take them to, you play back a narrative that's almost indistinguishable from what they would be doing when they were shooting up or in the context with the same people and things around them. They would experience it as similar, but the outcome would be different. So instead of them taking drugs, they would make a different choice, and the narrative would guide them towards something else. So they would be able to extinguish the association of being in this context, being around these friends and these situations, with then the inevitable getting high. That memory would start to fade, and they would extinguish from that. And what that did is it activated that network so that it was turned on, and that it put it into a plastic state. And then because the outcome was different, it allowed it to reorganize. And so now they associated that with extinction.
And was that work done with any kind of medication or substance on board, or that was just all their own cognitive thought with the virtual?
These studies are ongoing now. These were primarily done in animal models where they could erase fear memories from particular contexts by re-engaging them, putting back into a context, and then having a different outcome and playing different scenarios. Then they started doing this with virtual reality, and it started being therapeutic for humans. In the case of putting on psychedelics, what this does is it in and of itself, just the psychedelic, causes increased connectivity. It causes a greater connectivity between structures that are not normally connected. So, and part of that is what's called the default network. And the default network is the network activity. It's comprised of the prefrontal cortex, the temporal lobe, some in parietal cortex, and you can think of it like our self-referential thought when we're sitting quietly, or let's say we're driving on the highway coming into work. We don't have the radio on. We're just thinking, and our mind is wandering, or we're daydreaming. And then sometimes we have, in that case, you can have intrusive thoughts. If you have some kind of trauma, or you're going through something, or you're experiencing grief, then part of that can be thinking and dwelling on a particular type of thought. But it is a spontaneous manifestation. It's not directed by any stimuli. It's kind of what makes us who we are, and when we think about who we are and what we think about, it's our own private thoughts when our brains are allowed to spontaneously wander. That's the default network. Psychedelics disrupt that, and they take that network activity, and then they say, okay, now we're going to connect you to your auditory cortex, and we're going to favor connectivity to the visual cortex, and all of a sudden, inputs that, and let's just say that you're not driving, so don't get the image of taking psychedelics while you're driving.
Bad idea. That's
probably a bad idea. But if you're in a calm, low light environment with music playing, and you have a mask over your eyes, so you can think about what if you start to increase connectivity between other brain structures, then you're going to become aware of things that you'd never been aware of before. And those are going to come into your awareness. And at the same time, your ability to distinguish your own sort of self-referencing is diminished. And all you are is just one integrator of sensory inputs. Then that's a powerful experience. And it's one that you can think of it like a loss of signal to noise, that basically noise is now amplifying, or there's an increased gain setting on neuronal activity that's going on. And one of the things that I'm thinking of now is this thing that college kids used to do. I don't know if they do it anymore, but they used to play the Wizard of Oz with the Dark Side of the Moon album. And so they would sync up they'd watch Wizard of Oz. They'd start on
for the colors
on the third lion's roar. You start at the beginning, it's like MGM, what the lion's roar. You turn on Dark Side of the Moon, and you let the entire album play with the movie on mute. And the experience is that when they're high on psychedelics or marijuana, the experience is that the brain connects these two things and experiences it as though this is meant to be connected to the Wizard of Oz. And you see that the lyrics match what's going on the screen, and it gives you this weird feeling of connectedness. And that's the kind of sensation that people have when they're taking, when they reach therapeutic levels of this drug. And what happens when they come out of that is that it turns out that there is actual rewiring of the circuits. You can come out of that with people who had been preoccupied with intrusive thoughts and depression, and when they come out of that, they have a different outlook, a different worldview, where they're no longer depressed, and it's persistent, and it lasts perhaps indefinitely.
Wow. And so in that note, or along that line of thinking, is there an ability from plasticity side for, at a certain dose, to increase focus, as opposed to if you take so much, then you decrease the signal and you increase the noise, so everything is blending into one? Is there a spot where, oh man, if I just want to focus, then I'm gonna take less, or it never works that way?
Well, most drugs have a dose response curve, and sometimes it's called an inverted U dose response curve. Mm-hmm. And it's you can think of that. Alcohol might be one that many people are aware of. That you take low doses of alcohol, it increases it's kind of a stimulant. You talk more, you're more outgoing, and things are more interesting. And then there's kind of some euphoria. And then so you drink more, and then that starts to plateau off. And then if you drink more, you start to get into the depressed side. You start to slur your words, and you can't walk, and then you pass out. And so that follows that kind of inverted U. So I would say that we don't know much about the therapeutic in terms of clinical studies. We don't know much about the microdosing, but it would be expected that low doses would preferentially activate areas that have highest density of those receptors, and people might experience that as energizing. They might experience it in some ways that it might start to allow them to be maybe slightly more compassionate than they normally would be. I mean, these are very subtle. These are the things that people, that I've talked to. They talk about that they'll take a microdose, and things that might have made them upset, they tend to brush off, and it doesn't bother them as much. And you can just think about the opposite of what would happen if somebody took cocaine and someone's on a hair trigger, and then they want to fight you. It's kind of the opposite of that. So then as you take more of that, then you just end up getting more loss of intention and ego, and more blending of what's going on in your environment. Now, I told you before, the set was important. That's what the person comes to, but the setting is also very important. And the setting should be very calm. It should have, lighting and music to really get the most therapeutic
and you
benefits.
Mentioned a mask too, like should the eyes
they put on a mask.
Covered?
They usually put on a mask, and that just allows you could think of it as a gain setting, that the visual cortex can process no sensory or very minimal sensory inputs coming from the visual pathway to the optic nerve to the lateral geniculate nucleus and the thalamus to the visual cortex. But what you're seeing when you have the mask on is just the cortex generating its own patterns. Now, on the other hand, you could have some low level of lighting or patterns, and you start to see connections between things. I mean, think of it as amplifying noise. It's like that movie that Jodie Foster was in, where I think it was Contact, where she spends a lot of time listening in static for aliens, and so she's listening to these telescopes, trying to hear if there's any signals out in outer space, and so it's basically a lot of white noise that she's listening to, and your brain can put white noise and turn it into patterns, and so you think you hear something, and it can play tricks on you. And it's like that. If she were to do that on psychedelics, then she would hear lots of messages from from aliens.
Well, one of the things that people report when they go through this process is this oneness, like you talked about, this dissolution of self and being all inclusive with everything. And some people really have valued it, and this has been going on for just so long in these other tribes and peoples, of a spiritual experience where it's a way for them to connect to God or the universe, that kind of thing. Is that something that from the scientific research side, like you said, for pretty severe depression, a couple sessions and you get a long-term gain from that as you rewire? Have you noticed that through research that anybody that makes a spiritual connection, as they would define that becomes a long-term life change as well, that now they are maybe more grateful or they're more at peace with their issues? I know some cancer patients who are terminal will take these kind of things and they feel more like, okay, I can deal with my end of life situation because I know that I'm part of the universe and all that thing. Is that an ongoing thing that science has seen, or any research?
I think that this, in general, the feeling of connectedness is something that is therapeutic. Not knowing what's happening in the afterlife and not knowing, that's existential anxiety. That causes anxiety, the not knowing. What happens to our loved ones? Will we see them again? It's comforting for us to know to think that we would persist and that everything is connected in some way. And whether it's belief in, some monotheistic tradition, Judeo-Christian ethic, or whether it's a polytheistic notion, it's something that's crosses time. We have indigenous peoples that believe in gods. It's like one of the fundamental human traits, and I think that it is directly related to the prefrontal cortex and our brain's need to explain the unexplainable and to feel connected and to integrate our emotions with our experiences and our memories. And so I think that it does this. It's sort of short circuits it, where someone who's a devoutly religious person might experience this in some kind of religious ecstasy where they're meditating or they're worshiping. They may experience this kind of connectedness and activate the same sort of receptors. But it may be possible for an agnostic or an atheist, someone who's a non-believer, to take these drugs and also experience the same kind of euphoric connectedness with the universe, and also still have some benefits. Now, I think at the cellular level, we simply don't know much about how this occurs, and this is something that my research has been, I've been interested in trying to understand. And I think that if you really think about it, even at the cellular level, our brains are designed to detect signals from noise, and our brains are designed to engage in plasticity and to reorganize and to
throughout
remember.
our lifetime, right? Not just when we're young, but for
absolutely,
yeah.
Our whole life starts with we're born with the most neurons we'll ever have, and very rapidly we prune off about half of those connections.
Wow,
so
half of them.
We don't hold me to that number, but
okay.
it's a substantial number of connections. Yeah, and we prune. That's what learning and memory is setting up a lot of connections and then pruning back what we use. And so we have about 86 billion neurons. Each one of those have about 10,000 synapses. And so the way that I like to look at this is, you can think of a dense forest with tall trees and lots of arbors and branches on these trees. And each leaf is equivalent to a synapse or a spine that we have on our neurons. And what you can think of this as is that it's important for us to detect, let's say, just to keep this forest analogy going, it would be important for us to know how many birds are landing on the trees versus squirrels. And we can tell what's a squirrel versus a bird by the deflection of the leaves and the branches in certain trees. So we could pinpoint where these things are happening. And so in general, the forest can code for things that interact with leaves. Okay. Now, think about what happens when a brisk wind comes along and starts blowing everything All of the leaves and branches are blowing all over the place. What happens to your ability to detect a squirrel versus a bird?
It's going to decrease.
It decreases. And that's exactly the sort of analogy that I would give that when you're taking psychedelics is your ability to distinguish the importance and put the importance of this particular event or this particular memory. It starts to fade into the noise of the background. And our neurons, one of the ways that we do that is our brains are very, very tuned to causal relationships. So in order for us to detect patterns, neurons have to be able to tell whether or not an input that comes in that causes a depolarization of the neuron and it fires an action potential, which is an electrical signal that signals the next neuron. It has to be able to tell whether or not that's a causal relationship. The input leads to the output. Now, what happens if there's an output and then an input comes in shortly thereafter? It's not possible for that input to be causally related to the output.
Right.
So what happens in that case is the neuron says, no, we're not going to listen to you. We're going to dampen you. And so it depresses anything that's uncoupled with the output and the input. It suppresses. And this is called spike timing dependent plasticity. And what comes out of this is our brains are able to distinguish causal relationship. This input came, fired the neuron. This is causal, potentially. It's really just correlated in time. It's potentially causal. But we do know that things that are anti-correlated are not possibly causal. So our brain says, okay, now we've got an ability to it accomplishes two things. It enables us to tell time, which we're really good at. Humans are very good at processing time and prediction, because we need to be able to process time so that we can predict. And prediction is something that enables us it increases our survivability if we can predict what's about to happen. So our brains are very tuned to pattern detection, timing, and prediction. What happens when you take psychedelics is it takes away, and this is some of the research that I did as a postdoc at Northwestern, is it decreases the ability of that action potential where it signals to the next neuron. It decreases its ability to signal to the synapses that of the inputs coming in that the cell output is just fired. So it erases the ability of the neuron to remember what's causal and acausal. And things tend to become, it selectively takes away the acausal component. So it makes it seem like more things are causal. Things that are explicitly not related are interpreted as meaningful at the cellular level.
Yes.
So in that case, if you think about what that would do to a person is you would start to see things, see patterns of connections between things that are not there. They would explain the synesthesia of how it is that you could control lighting by listening to music or by touching your hands. Things that are not really related would be perceived as related. This process is so powerful and meaningful when this happens that it's something that it ends up being therapeutic to the individual. Now, the individual doesn't have to know all this stuff is going on, but I'm trying to explain this at what's going on at the cellular level, that it's kind of an epiphenomena. I mean, at the end of the day, there is a disruption in neural processing where noise is amplified. And it doesn't sound very romantic when you talk about that way. Well, what's a hallucination? Hallucinations are really like the trailing that you see with lighting and stuff like that. It's really just the loss of the ability of neurons to process causal and acausal inputs and then connections to the thalamic relay network, that you get timing disruptions. And when you lose that timing and the brain can't tell what's causal and acausal, it just blends everything together. And then when you then your self-referential network looks at this and says, this is meaningful. This has never happened before. All things must be connected. Now, if you have a spiritual sort of rubric that you work within, or you have you're trained in some kind of religious doctrine where you can classify and put this into some category of, well, this belongs in a supernatural things, it's in the category of things I can't explain, so we're going to attribute this to God, then you have a very easy way of digesting this information and using it in the traditional, cultural, appropriate ways with your religious tradition.
Right. So one group might interpret the experience differently than another group if they look at a spirituality concept differently. If one believes in reincarnation and one doesn't, then they might have a different spiritual experience or interpretation of that experience as it applies to them or their culture based on these boxes.
Absolutely. So you can have common experiences from a Muslim, a Hindu, a Zen Buddhist, a Christian. They could all experience the same kind of phenomena, but interpret it in different ways that's consistent with their cultural heritage.
Right.
At the end of the day, it's going to come down to their brain processing different inputs.
That's so cool. That is so cool. Therapeutically, we talked about people taking these substances for depression. What are the other clinical uses that we're finding or that we're studying that these compounds could benefit folks from?
Cancer, people who are end of life. There seems to be a dramatic effect for that, for folks that have been diagnosed with AIDS, and some cancers where they're just facing end of life. It puts things into context. It makes them feel like there is a connectedness to the universe, that it's not finite, and that the anxiety that comes with the loss of ego, which is really that existential anxiety. Mm-hmm. I'm not going to exist. I'm not going to be able to control my environment and persist. That's probably one of the main fears that people have. If you can get rid of that, then there is no fear of death.
Yes.
So it's definitely something that is used in. And it probably has been used for a long time in those scenarios.
And what about, I had heard something about them being potentially effective in addictive processes as part of treatment, whether it be alcohol specifically, I think is what I heard about. I don't know if other substances like you talked about, cocaine and some of the others, but is that something that it's potentially used for?
I think it's potentially it's possible that it could be used in that context. It's a little bit tricky because anytime you try to treat, if you look at what's the problem with addiction, it's drug taking. And then telling a person that they should take a drug in order to combat drug taking is kind of paradoxical. Mm-hmm. You're teaching them to go from one drug to another. Mm-hmm. So it's tricky in order to engage the right circuitry and to have them, I think that they're in some ways for nicotine dependence, it's useful, and it's potentially useful for reorganizing drug addicts, but it's just something that's ongoing research. And the real sad thing is that it's the whole issue has been stigmatized so much politically, and with the way our laws are set up, that it's difficult to research. Mm-hmm. And if you don't allow researchers to actually get in there and ask the questions, then how many decades have we gone where we could be researching this and we would know? I mean, back in the 80s, MDMA was used in a therapeutic context for couples therapy, and then it was stigmatized, and now how many years later is it? 40 years later, we're coming back and saying, oh yeah, you know what? It might be useful in some kind of a couples therapy and talk therapy where people can empathize better with each other.
And it's another psychedelic, isn't it? MDMA.
It's a different type of one.
In that family, it's a different compound, so it has maybe a little different effects.
Yeah, it has different effects, and it doesn't hit the 5-HT2A. It hits some different receptors in the uptake transporters, and it causes more empathy. Feelings of attachment, mm-hmm. and connectedness like that, and interpersonal space. So I think a lot of these drugs could be potentially useful in a therapeutic context with minimal side effects, minimal adverse effects.
And that was one of the things that I wanted to ask is, so we've talked about where the research is now. Is there a thought of where it's heading, of maybe a place we haven't talked about yet, where you're seeing where it's going, and what are the side effects or the potential downfalls of this? We talked about a bad trip. We talked about if you're doing this unsupervised, not a good idea, because setting, making sure mm-hmm. those are right. is there something that you're seeing where we're going in this direction to, the frontiers of this could be this way, but these are the potential issues that we might face?
Well, it seems like right now the legal side, there's some states are legalizing the use or the possession, but not allowing the sale. And there's some states that are allowing therapeutic use. But it's very ill-defined. And what's happening is that it's kind of a Wild West. It's similar to what's been going on with cannabidiol, CBD, where the federal government and FDA have failed to put in place any type of regulation. And so what's cropped up is a multi-billion-dollar industry of CBD that's completely unregulated. And I fear that the same thing will happen with this, as people will start growing. They're already doing this. People are growing mushrooms, and they're passing them back and forth, and people are doing this on their own. So I think that if that's the way that it's going to go, well, it's kind of difficult to research. Mm-hmm. So I think that fortunately, there's not a lot of these drugs tend to be relatively safe. There's not the issues of, if you compare it to alcohol, I would say there probably there's an argument that these might be considered in some ways, if you just look at the physiology in terms of vitals of heart rate and blood pressure and things like that, they don't tend to produce much changes. They could if the person's in the wrong set and setting. You could get an adrenal activation and your adrenaline goes because you're having a bad trip. Mm-hmm. But generally speaking, because of the specificity of the 5-HT2A activation, you don't get a lot of vascular side effects. So it's very specific to the brain region and not a lot of peripheral effects. So in general, they tend to be fairly safe without a lot of adverse effects.
So would there be anybody that if they were listening, obviously, we'll kind of maybe finish this in a few moments on if they were interested, what their next steps would be to try to figure this out. Because again, it's such a Wild West with respect to who can do what, where, when, and how, state by state and federally and all that. Yeah. But is there someone that you would definitely recommend not try this without it?
Yeah.
Because it could go real south real fast.
Yeah. Those would be people with a family history of schizophrenia and psychosis. Schizophrenia is with positive psychosis is characterized by delusions, loss of reality, auditory hallucinations.
Do people know they have that when they have it? Are they aware that they are delusional? They hear things, but are they aware that's not normal for them, or does that need to be diagnosed from the outside to help them understand that?
Yeah, it's hard. I guess it's hard to say. Each individual is probably a little bit different, but when someone's in the midst of a psychotic episode, if you've ever experienced paranoia or dealt with somebody who has paranoia, it's hard to convince someone with paranoia that they shouldn't be concerned about something, mm-hmm. because they would just tell you, well, of course you would tell me not to be paranoid. And right. So people who have delusions and paranoia often have convictions that fly in the face of reality, and that kind of defines delusions and paranoia. And since this is mainly psychosis is mainly a prefrontal cortical problem that involves dopamine and glutamate transmission, and it crosses over into the same signaling cascades as the 5-HT2A, especially metabotropic glutamate receptors, activates the same cascades, and it can cause the same type of discontinuity with reality. And so adding to that would cause the person to likely go into a full-blown psychotic episode. And so the people who should not definitely should probably avoid taking it unless, even in a therapeutic context, I don't see that it would be ethical to treat someone who has psychosis or schizophrenia. Mania, probably, bipolar would be challenging. Some people with anxiety may or may not react to it well, but I think mainly just psychosis and schizophrenia would be the ones that should, and even I think people who are acutely under the influence of any drugs, you certainly wouldn't want to give someone who's ingested alcohol or intoxicated, or experiencing, other drug addicts would be a difficult one you'd have to manage that very closely, and they'd have to be withdrawn for a certain period of time probably.
Any issues with cardiac effects from these kinds of substances or compounds?
There don't appear to be many effects on the heart. You take marijuana can increase heart rate transiently while you're taking acutely, and what we see with these compounds is they don't actually increase the heart rate, tachycardia, bradycardia, things like that. So they tend to be pretty cardiac safe in the therapeutic context at the doses, insert all the caveats,
right.
At the right doses and under the proper supervision, with somebody who doesn't have any pre-existing conditions. They tend to be, fairly safe.
What do you think about the possibility, and this just hit me as you were talking a little bit earlier about MDMA really connecting with our emotional intelligence, our EQ, if you will, of connectedness and that kind of thing, empathy. And then you've got psilocybin that's allowing us to become one and uniform and all that kind of stuff. Is there a place, or is this in process where if someone's got a certain set of symptoms that they would use a combination of these psychedelics, and not necessarily in combination at the same time, but they would use them alternately for one section of their life versus another section of their EQ?
Yeah. No, that's a really good question. And that would be I think that's a great study, because the empathogen qualities of MDMA are very specific when it comes to connectedness with another individual. And if you combine that with and also a little bit of anti-anxiety, and if you combine that with someone who may have a little bit of anxiety to the psychedelics with the ego dissolution and everything else, the two together might be more therapeutic. So I definitely think that you could, in a therapeutic context, you could decide whether someone might need a little bit of MDMA versus a little bit of psilocybin, and with the appropriate counseling, that could be very beneficial.
What do you think the trajectory of all of this is headed? Do you think it's towards more legalization as it has been in the face of marijuana? Or do you think that it's still trying to be kept under wraps until further notice, until more research comes out? What do you see the trajectory of this?
Well, I think that as long as something doesn't occur to set us back, where we have, it's similar to gene therapy. Back in maybe the 90s, when we were talking about genetic engineering and inserting viruses to reverse certain childhood diseases, we had the technical capability of making an adeno-associated virus and giving it to them, and then it technically should have replaced the missing protein, and the person should be able to survive. And what happened was the person died. A few kids died in response to the viral vector, and they didn't really understand why. And so that set back genetic engineering maybe a decade or two, just because of a bad clinical trial with a bad effect. So I think that we're past that. I think that now we have enough clinical trials to where we know. I think a number of people have been using this for decades, and we know the sort of safety profile. The issues I think are going to come in with the regulation. It's going to come in the black market when they start mixing in fentanyl and things on the recreational side. I think people might get the impression, like if kids start to get the impression that it's safe, I keep saying that, it's safe under a therapeutic context for adults. I haven't talked about whether or not that's true for kids. And so there's often, if you think about kids, the prefrontal cortex is the most highly evolved structure in the brain, and it really doesn't stop developing till about the age of 23, 25. And so because of that, if you were to give adolescents, if they were to take, and the same is true with marijuana, it also affects the prefrontal cortex, and it can lead to an increased risk for schizophrenia. If adolescents take marijuana repeatedly, which is why they should never take it until they're fully formed adult. But the same goes for these. We don't know whether or not there's going to be an increased risk. We don't know if these drugs, how they affect kids and adolescents. So until we know that, probably a good idea for kids to stay away from it. And I just don't know. I don't know how kids get drugs anyway. I mean, they buy them from their friends or they get them from somewhere, and those are not regulated. And who knows what's in them. And if we get too much of that going on, then it's going to stigmatize the whole thing, and it's going to set us all back. Yeah. So we need to have a rational way of looking at this in a way that's makes it accessible to the people who need it, and also prevents people who would use it improperly from getting it. And so
there, right now, if I hear you correctly, there's no dose equivalent that you would take it down for kids. It's just that data, whether it's good or because their minds are still forming, let's stay away from that till they become adults. We haven't crossed that horizon or that threshold yet to understand.
I mean, I don't want to say, parents, kids can suffer from a lot of behavioral issues, operational defiant syndrome, where it can be very challenging for parents to deal with them. And they give kids psychostimulants all the time. They give them ADHD. They give them ADHD medications like Vyvanse or amphetamines or Ritalin. There are lots of drugs that we give kids in order for them to process, even antidepressants. Is it possible that there could be a therapeutic use case? I think so. But that would really be up to a psychiatrist who has the freedom to experiment with that. I really think that I just don't see scenarios where poly drug use is useful. I wouldn't be giving someone who has an ADHD, giving them amphetamines plus psilocybins, and plus antidepressants. It's like the main problem with psychiatry is over medication with multiple different types of drug classes and polypharmacy. So if it was going to be done, I would say it should be done in a monotherapy in the context of a counseling.
So kind of winding this up then, if someone is curious and they want to learn more about psilocybin, where their next steps would be to find out if it would benefit them in some way, do you have any advice on the direction that they would take to learn more about any of this?
To learn more about it, it's hard because there are other podcasts. Andrew Huberman talks about this a lot.
Robin Carhart-Harris talks a lot about it on his podcast.
So here we have some information. It's hard to. I don't know of any authoritative, other than going in the scientific literature. There may be some psychiatrists or psychologists who are specializing in this that they could look up and talk to.
Okay. Well, I'll tell you what, as the head of our medical sciences division here at the firm, you have just brought such a wealth of knowledge and certainty to so much of what we do in our med sciences division, and I can't thank you enough for being here. Is there any last word that you would want to have as again, you're a teacher, you've been a professor, you've been published so many times, you've had all this. Is there all these credentials and all this experience? Is there something that you would want to finish with about this particular topic, whether it's psilocybin specifically, psychedelics in general, that you would say, hey, listen, from my perspective, as my education, my background, my role as basically the head of the whole med science department here at the law firm, anything that you would want to close with or let people know as a final thought?
I think that in general that people should take an open mind to looking at these compounds and how they can be beneficial for recovering from all sorts of trauma. And if it's done right, I think they should keep an open mind and seek out professionals who are willing to help them and to not shy away from this type of a therapy because it doesn't fit some medical model, that's some traditional medical model. I think there's a lot of evidence that these things can help a lot of people, and people should in general keep an open mind towards that.
Awesome. Dr. Cooper, if someone had a question or wanted to learn more about this or just kind of pick your big brain, is there a best way for them to reach out to you to contact you?
Yeah, they could just email me at drdon@ramoslaw.com.
Dr. Don, D-O-N, at Ramos, R-A-M-O-S law.com. So there you folks have it. I know there was a lot of information here. You're going to have to process this. You may have questions for Dr. Don. And in fact, we're looking for opportunities to share more of his information on other topics in the science and science-related fields. So if you have questions or things you'd like to hear more that Dr. Don and I visit about, please send them to me. My email is Jim, J-I-M, at ramoslaw.com. And we'll set something up because Dr. Don and I have a great time doing this. It's just, he's one of my favorite guests. Been here the most times of anybody. He works with us every single day as the head of our medical sciences division. It's just an absolute pleasure. So Dr. Don, thanks for taking the time today, and look forward to our next one of these.
Yeah, thank you.
Absolutely. And for those of you who have seen this, please share it. Please watch it again, ask your questions. And remember, in everything you do, look to make a difference.